Cancer impacts people of all ages, including younger adults. Dr. Donald Karcher is the president of the College of American Pathologists, and he's here to discuss this rising cases he's seeing in this particular demographic. Good morning.
Good morning, Angie. Thanks for having me.
Well, help us understand what you're seeing and why you think these soaring cancer cases are happening to these younger adults.
Yeah, well, this is a very troubling trend. Cancer rates in young adults have been going up worldwide by around 1 to 2% per year over at least the last 3 decades. Now, what's causing this? It's probably not a single thing. It's probably multiple factors, probably having to do with diet, lifestyle, things that young people are exposed to. For diet, a high-fat, low-fiber diet, or a diet high in ultra-processed foods like cold cuts, diet sodas, things like that. There's evidence now that may be underlying this increase in cancer diagnosis. Also, lifestyle things, not enough exercise. Obesity, we know, is associated with certain cancers. Smoking, obviously, is associated with lung cancer, but smoking can lead to at least 8 other types of cancer. Alcohol consumption is suspected as a factor. Exposure to sunlight, of course, because of skin cancer. Some newer things, like there's a concern for overexposure to medications. Some medications we know that have monoclonal antibodies in them, we know they're associated with certain types of cancers, but things that we didn't suspect before, like maybe overuse of antibiotics because of the impact that antibiotics have on the microorganisms that live normally in our gut. The biggie is exposure to carcinogens. These cancer-related chemicals are increasingly everywhere in the environment. So we don't think it's a single thing. We think it's a combination of all of these factors that's underlying this increase in cancer in young adults.
So symptoms, I mean, this is such a big picture. What should people in this age group or these age groups be looking for?
Yeah, well, not all cancers have symptoms, but symptoms should certainly be a warning sign. So here's a list of things that people should be aware of. A swelling or a lump, unexplained pain, unexplained weight loss, change in bowel habits, persistent fatigue, maybe blood in the stool or the urine, a chronic cough or hoarseness, even a change in a mole or a skin lesion. Any of these things could be a warning sign of cancer. Now, they also could be associated with other things, so it doesn't automatically mean that a person has cancer. But this list, we feel young adults should be very aware of and be on the lookout for. And if they have any of these, they should see their doctor to have it checked out.
Well, let's talk a bit about screening and early detection and how important that is.
Well, screening is very important. Now, we don't have screening tests for all cancers, but there's some very important ones. Breast cancer, for instance. And this is actually breaking news. For women with an average risk of breast cancer, the new recommendation just announced this week is that they should start having their mammograms at age 40. And for young women with a higher than average risk, because of family history of breast cancer or other factors, they should start their screening even before age 40. For cervical cancer, screening with Pap test and or HPV screening test should begin at age 21. Screening for colon cancer is now recommended to start at age 45. That's earlier than previously. And for those people that might have a higher risk of colon cancer because of certain factors, they should start their screening even before age 45.
Can you send our viewers to a website where they can learn more and maybe find some answers for the questions they'll surely have after watching this interview?
Yeah, happy to. So a great website is the American Cancer Society website, and I would search that website using the words cancer in young adults. There's going to be a lot of great information about what we've been talking about there.
Dr. Karcher, thank you so much for this important and valuable information.
Thanks, Angie. Thanks for having me.
And we'll have more local lifestyles right after this.